Hey, welcome to episode 6 of the Go-To Physio show. Coming up in today's show, I take you through a step-by-step way that I can maintain my focus and attention to make sure that my patients earn the right to progress through every step to achieve that ideal outcome. And I also share with you the one thing you have to be doing if you want a profitable, thriving word-of-mouth private practice. I hope you enjoy the show. Okay, so welcome to episode 6 of the Go-To Physio show. Now, what I'm going to share today, it's called Constraint-based Physio, okay? I'm not even sure if I've just made that term up or not, okay? And if I haven't, I'm not too worried about it, okay? But Constraint-based Physio is a process where you don't necessarily worry too much about the outcome, okay, or the end goal quite yet, but all you're focused in this session is getting your patient to the next stage. And the power of constraints is something magical happens, okay? Now, if you've been watching episodes, especially episode 2 in the Go-To Physio show with Carl Morris, what happens to the physio is that, or the sports therapist, physical therapist, whoever you are in terms of a healthcare professional, is your attention becomes very specific to a certain thing, okay? And once your attention becomes a bit more intentional to help that patient get to the next step, you tend to forget about or get overwhelmed with all these kind of things that you don't even need to worry about yet. So just to give you an example, so if we've got our patient, okay, and this is their first session, okay? So their first session, they come into us with knee pain, let's say, for instance, and their end goal, okay, is to get back playing rugby league, okay? So we'll keep it in my world, okay? So we know in rugby league that person needs to change direction, okay? They need to accelerate, okay, at 110%, as I call it. They need to decelerate, okay, which will obviously feed into that. They need to be able to take contact, okay, among numerous other things, okay? So sometimes what I see a lot, especially in the early doors of my mentorship, is therapists, they get so overwhelmed with this that their attention, okay, is all over the place. Whereas what we should be doing first, okay, in a constraint-based physio approach, which is what I teach in my mentorship, is we just go step by step, okay, and we use some key performance indicators, okay? Now, once you focus on your key performance indicators, then something magical happens. You don't skip steps, okay? It's a very logical, step-by-step progressive pathway, and then what tends to happen is you naturally tend to gear towards that true stressor in the first place, okay? So for somebody with knee pain, what I want to find out, okay, is the 80-20 rule, okay? Is, yeah, we know that knee is overloading, okay? And we're going to address that with maybe some hands-on work, etc. But then the 80% is why, okay? Why is that knee overloading in the first place, okay? So my first step with this person, my first big KPI, okay, is I want to restore full range of motion, for instance, okay? That could be a first thing for the 20%. And then for the 80% is I just want to be able to tolerate some baseline level of loading in the direction that maybe isn't doing its job. So if we've got traditional tendinitis, tendinosis, whatever you want to call it, okay, in the knee, usually we might find a different direction isn't tolerating load, the lateral direction, okay, through the lateral hip or something. So in that first session, all I want full range of motion, okay, and I want that person to be able to tolerate load in the frontal plane. Okay, now I've got my tests that I use, and you probably have your tests, okay? So I teach some specific stuff in my mentorship here, and that's all I want in that first session, okay? And there's no point me worrying about that person hopping, lunging, etc., unless I know they can tolerate load through that lateral direction if that is the problem. Now this knee pain, it may be the complete opposite side that we need to look at. Again, that goes back to your assessment. But the big thing here in that first session is I'm not overwhelming myself and I'm not overwhelming the patient, okay? So we give a very effective explanation as to why we're working on certain things here and how that then is going to relate to the next session, okay? So what tends to happen then is every single session, you just progress. You progress, you progress, you progress in a very logical step-by-step manner, okay? So that's the first thing I want to do. The second session, I'm going to go back and I'm going to recheck my KPIs, okay? So I'm going to have 1 or 2 KPIs. If I've restored full range of motion, okay, in the first session, I'm going to go back in the second session. That's the first thing I'm going to check. If they've kept those gains from the first session, happy days, now we can progress, okay? If they've lost that range of motion again, then that's an alarm bell for me, okay? Have I really found a true stressor, or has the body gone back to a kind of a movement habit that it originally went to, that ultimately led to this pain experience in the first place, okay? Now, if everything's good, then we go back up onto the next one. So for the first session, you may get them loading that hip in the lateral direction in a very slow, controlled manner. The next one, we might get a little bit more dynamic, okay? Then when we go to our hopping progressions, we're going to really want to isolate, or not isolate, but we're going to want to bias that direction with that lateral hip as well, okay? And again, if you're in my mentorship, you know exactly how we do that. It's very, very simple, okay? But the big thing that happens in your sessions is you'll find that 30 minutes is more than enough per session, okay? So what you give your patient is you give your patient 1 or 2 specific exercises to solve a problem, okay? The exercise should be the solution to the problem that you're finding clinically. And that's very, very powerful as well, because then you're not just throwing crap at the wall and hoping something sticks, but you're actually giving your patient a solution to a problem that you found in the assessment. Okay, and again, that effective explanation, very, very important that they understand why they're doing these things. Okay, so then by the 4th and 5th session, what you're going to find is every single session your patient is progressing. Okay. And you're very, very comfortable then, because you know that you've got this thing. Before you get that, okay, before we can move on to the hopping, we need a few more things to happen. Okay, we need good co-contraction of the knee, we need good intent through the foot, we need the ability to absorb load in all directions through that limb, not just maybe the sagittal plane, for instance. Okay, so that's something that can make a massive, massive difference in giving you confidence and clarity. Okay, so I call it now constraint-based physio, okay, or constraint-based approach, where we're just worried about 1 or 2 things. Okay, we just want to get these right, then we want to progress to the next thing, then we want to progress to the next thing. The nice thing about this in professional sport as well is then timelines don't become that irrelevant, okay, or don't become relevant, sorry, okay. Now obviously we need to appreciate healing times post-op and stuff like that, okay, but if we go through this constraint-based approach and we go step by step by step, what you'll find is that you'll progress your patient back here very, very quickly, okay. So your intent, your attention in that first session, it's all about restore full range of motion, desensitize, find the true stressor and give that some baseline tolerance of load, okay? So again, if you are sprinting, that might be, like say for argument's sake, 100% maximum voluntary contraction, which is probably more, but just give or take, okay? Where here we just want that person to be able to stand and tolerate load through that hip when they do some movement that's meaningful for them, okay? And if we can get that session, we can check them in the next session, move on, continue to progress in that logical step, okay? So that's a really, really powerful approach. The next maybe scenario that I want to give you as well, just to apply this, because we're going to talk about the hamstring next week in the next episode, is the slump test, okay? So rather than having a back pain patient, okay, or a hamstring patient that we think is neural, okay, and I hate that term, okay? When you go through your slump test and you get a positive response, rather than just thinking about the nerve, okay, let's think about what's influencing that neural tension, okay? So when I go into a slump test, okay, I can change that response pretty much instantaneously with the vast majority of my patients, okay? So let's look at what has to happen when you go into a slump test, okay? So one of the first things that has to happen is we need ribcage depression. We need the diaphragm to lengthen, we need the intercostal tissues at the back, okay, of the rib cage to lengthen. We need the iliocostalis, which attaches from the ribcage down into that thoracic lumbar fascia, to lengthen. All those tissues need to lengthen, okay? So if I desensitize a lot of those tissues, very often that slump will change very, very quickly. We take away that neural tension, okay, that we are basing on one test, okay, and then we move on to the next thing, okay? But rather than just focusing on that low back, all I'm focusing on is that KPI. Let's take away that neural tension. Let's get that person actually relaxed when they're sitting, okay, which they're probably going to spend a lot of their day anyway, okay? Now let's move on to the next thing. Slump test, bang, desensitize, brilliant. Or in the real world, we might desensitize that maybe 60-70% of what it was when the patient came in. But again, guess what? I'm going to check when I come back in on that second session. What's your slump test like now? Okay, if we've kept the gains, we might just have a little bit more to get in the next session. But guess what my rehab program is for that person? It's teaching them to maintain the gains that we've got in that first session. Okay, so then we've taken a big elephant away, and now we can focus on maybe the more intricate stuff specific to that person's injury history. Okay, so that's just another example like that we're going to look at in the hamstring assessment in our next show. Okay, so as I said, the KPIs, using KPIs every session, having that step-by-step progression, it's going to be very, very powerful, okay? And in the Build Your Business segment today, I'm going to show you why using a constraint-based approach is very, very effective, okay? It keeps your attention, number one, okay? And it allows you then just to have one goal or one main outcome in that session. You hit that, the next session you have a new goal or outcome, okay? So all your attention is based on that. And if that is part of that step-by-step plan for that patient, okay, then it's just a matter of time before you're going to reach that goal, okay? And I'll tell you about how this is going to affect your business and stopping your patients drop off in the Build Your Business section later in the show. Okay, so welcome to episode 6, Build Your Business. Now, in the main teaching segment of today's show, we talked a lot about the advantages of using a constraint approach. Now, what I want to show you is from a business point of view, why that's going to be very, very effective to you. Okay, and I say this a lot, the cheapest, the fastest way, okay, to get increased revenue, increase your rates, okay, increase your referrals, especially word of mouth referrals, okay, is by getting long-lasting results for your patients that makes meaningful impacts. Now, the big advantage of using the constraint-based approach is every single session your patient is making progress. Now, probably the biggest reason, okay, that patients drop off, okay, or they stop coming to see you is they feel or they perceive a lack of progress, okay? And that's pretty much the same in all walks of life, okay? We lose motivation when we feel like we're not making progress, okay? So just think about the power of that using this approach, okay? So every single session, the next session builds on top of the previous session, okay? You, through your effective explanation, can communicate that to the patient and they can see the progress they're making to get back to that ideal outcome. Okay, so this is the power of using the constraint-based physio, and this is where the clinical skills and the business skills, they have to go together. You can spend thousands of pounds on Facebook ads, okay, and I've done it, and I've spent thousands of pounds on Google AdWords, okay. You get that patient in, okay, and you might spend maybe 300 quid to acquire a patient, okay, or you might spend 50 quid to acquire a patient, but that patient drops off here because there's that perceived lack of progress. Whereas you nail your clinical skills, and then every patient that comes in, they are being able to be discharged with that meaningful impact, okay? So then instead of having 2 or 3 sessions per patient that comes through the door, they're all having 6, 7, 8, whatever they ethically need. Now, we're not talking about keeping that patient on just to fill our diaries. If that patient ethically needs that and they need to build resilience and tolerance to make sure the pain doesn't come back again, then I am 100% fine with that. Telling that patient they need to come back for that next session, okay? I've got a duty of care to make sure that patient, when they are discharged, that I do my very best to make sure that pain does not come back again. Now, I'm not talking about keeping them for 12, 15, 20 sessions if they don't need it, okay? But once you logically progress them through that loading, okay, then it's very, very straightforward. And again, I'm very used to this through the pro sport approach. Just because someone's pain free, it doesn't mean that they go straight back to the trainer. We need to take them through those KPIs to make sure that they've earned the right to be at that load, they can tolerate that load without flaring up or causing reactions, okay? So the building your business key point this week is that if your patient sees the progress they're making every week, then you're going to have one thing that's not going to happen to you, okay? Your patient will not drop off, okay? If your patient can see that they're making progress every week and you can justify that, okay, and they genuinely have to be making progress every week, okay, then that's the easiest and quickest way to increase revenue, increase referrals, okay, increasing your rates if you want to, because you're going to have the confidence now to get results, okay? But you do that all, okay, through getting long-lasting results, and that's what's going to get you the recognition to become that go-to therapist, okay? So as I said, you can have all the marketing strategies in the world, you can have all these telephone scripts, etc., but at the end of the day, we have to walk the walk as well as talk the talk in the marketing, okay? We have to be able to get this clinical skills top-notch so that every patient we can genuinely make that meaningful impact. So when you're designing your return to play program, we have to be mindful of the movements even from day one, day two post-op injury, okay? So when we send this athlete back, and if it's a rugby league player, Gaelic footballer, soccer player, rugby player, whatever, we're going to know they're going to need some kind of change of direction. So what we would have in the back of our mind, okay, and I'd advise you to go back and review the return to play section in the core content, is the step-by-step progression that ideally we need to go through. Okay, so when we're returning an athlete and he has to change direction, mechanically some of the tissues that are going to have to absorb force and produce force will be in this kind of direction here. Okay, so as that athlete changes direction, usually a foot will be planted as they tend to push. Okay, now how much of the foot's planted, whether they're on their toes, etc., it's going to be very, very variable. Okay, so again, we have to take it with a pinch of salt, but this kind of motion here is one that's going to happen a lot. So if I know when I get that athlete to start decelerating and then change direction, one of the first things that I can do prior to that is obviously that foot clock that we talked about, where we're getting the athlete to reach, and we're getting them to reach to maybe a 4 or 5 o'clock, okay? So if you just do that for me, Pete. So early in my rehab, we've done that, okay? And then what I would start to do then later on in the rehab, prior to the athlete actually getting back to change of direction, is we'd just start doing some kind of lunge, okay? So we're gonna allow a lot more force to transfer onto the right foot this time, Pete. So you're gonna start on your left, we're gonna twist, similar, very, very similar to what you've just done. But then I want all my weight to be accepted onto my right foot, okay? And then I want you to push back again. So you're gonna load it and then push back again, okay? And push, that's it. And push again. Again, I'm looking at the athlete. Pete's head's down now, so look straight out in front of you, Pete, as you do it. That's it, and then come back again. Nice and fast, nice and snappy, good. Okay, good stuff. So what that's going to do then is that's setting the system. It's putting these tissues under specific loads in a greater exposure. So by the time we get to here, he's already experienced these tissues and these movements and the bones moving in these particular ways already, okay? So we have some kind of graded exposure.
My name's Ed Foss, I'm a physiotherapist down in Gloucestershire. I've done a little bit of sports historically, but now I'm just working in private practice, so still treating a lot of sports people, but pretty much anything that comes through the door really. I think the biggest challenge is we're knowing how to progress my patients from getting them away from pain and then being able to confidently get them back to running around a rugby pitch or swinging a golf club and not have any real concerns about them re-injuring themselves. And I felt I was stagnating a little bit. I needed something to challenge me clinically, and I was a little bit unsure to start with, and actually having spoken to a few people who'd done the mentorship previously and gotten nothing but glowing feedback about the mentorship and about Dave and about the content, then it was an easy decision to make in the end. It's given me a bit more confidence. In fact, it's given me a lot more confidence in taking a more of a holistic approach to my patients. I like the fact that there's a big focus on that subjective history and really getting to know the patients and build that rapport rapidly. But really it's given me the confidence actually to back my ability to safely get them back to what they want to do. It's improving my ability to build rapport with my patients quickly and help them build trust in me and confidence in me, which ultimately means that they get on board with the treatment plan and they're happy to come back in and see me. I would say do it. I'd say it's a big commitment, but the content is fantastic, and there's a lot to take in initially and a lot to put into practice, but it's completely changed the way that I look at my patients, and for in a much better way. So I would say, just take the plunge.
The Therapist Mentorship Program was put together to help you accelerate your ability to have confidence and clarity with any patient that comes through the door. It's a very intimate 90-day experience where you work closely with myself and my most trusted therapists to put together a very specific structure in your assessment, your treatment and your rehab for every single patient, so that you can truly get the results that both you and your patient deserve, so you can become that go-to therapist. If you want more information, just click on the button below this video or go to thegotophysio.com/mentorship.